Welcome everyone. In this video, I will show you how you can use CDS hooks for population health analytics. Now, why would you want to do this? CDS hooks provides a very structured way to both define clinical logic as well as deliver insights. By taking this approach, we can really get a reusable framework that can be used for triggering clinical decision support both at point of care as well as for population health. To keep the demo simple, I will be using a CQL, clinical quality language based CDS hooks. However, I will also show how this can apply to any CDS hooks. And hopefully you will be able to appreciate how this can be very powerful, especially with AI based algorithms applied to clinical decision support. So let's jump into the demo and I'll explain more as we go along. Okay, so I'm in a MeldRx workspace and I have some sample patients loaded. I'm going to go click on one of the patients in here, Tiffany, and you will see that I will get an alert, an informational alert telling that, I need to tell the patient to relax. Now, this is a very simple CDS hook service that we have configured. And what it is really doing is it's going through the patient's conditions and it tries to look that if there is a condition of stress, it will basically generate this card. So you can see here that I have this condition of stress. That's why it is generating that card. If I go and look at any other patient that doesn't have that condition, it will not generate that card. To show you just a little bit more about how this is configured, again, this is a very simple CQL based CDS hooks. So I can just go into that particular extension. And if I go and say, okay, show me the actual CQL logic, you can see that the inclusion criteria there is that if this NOMAD code exists, then, I'm going to go a recommendation to say that, you need to relax. If that code doesn't exist, it doesn't show that alert. Again, we are keeping things simple in here. There is a lot more that can be done from a CQL perspective, but we are just going to start with that logic. So again, I have a list of patients and let's just say that I wanted to go and find out all the patients that have that stress condition. What I can do is I can go to population trigger and I'm going to say that I want to create a population trigger. So when I click on that, it will give me the option to select any of the CDS hooks apps that are configured. We call them extensions in MeldRx. There is some other things kind of that go along with it, but let's just say we have that as an extension in here. So I'm going to say I want to click stress monitor. I want to run it across the entire workspace. I could also run it for a specific fire group. And I want to basically get all the informational indicators. Again, every CDS hooks could be configured in different ways. So you can say, I want to just run the critical alerts or I want to run the warnings. In this case, we are trying to keep things simple. We only have informational cards in there. So I'm going to just say, I want to, basically run that. I'm going to click on to say, I want to create that population trigger. So in a simple way, this has actually created like a trigger for me that I can configure whenever I want to run. I'm going to go ahead and run it right now. So I'll say that I want to run this population trigger. Now, I only have a few 10, 12 patients in this particular workspace. If this workspace had a lot of patients, obviously it will take some time and depending on the algorithm, depending on the queries. But what I can do here is I can go and say, just load the reports. So it shows me that this trigger was just run right now. And then I can go ahead and click on that particular view report. So what you are seeing now is that it's basically has run that trigger across all of the patients in the workspace and has created a list for me of the patients that have that particular condition. And again, as I said, the CQL logic could have been anything. We are just trying to keep it simple. And at this point, I can actually see whatever the cards was. So you can see like depending on how the CDS hooks was structured, I could have any kind of logic or algorithm applied in here and get the alerts from right here itself. But I could also then just go to that particular patient chart and see what are all the different alerts that are configured. Again, in this case, we had not configured any of the other CDS hooks. So it's only showing me that particular alert. But to make it even more interesting, let me actually go back and configure some more extensions, some more CDS hooks into that particular workspace. So what I'll do is I'm going to say I want to activate some new extensions, and I'm going to go ahead and click some extensions that I have deployed. Again, these are some other CDS hook services that are available. So I'm going to use one that we have different kinds of card services that will give you an idea what all can be done. And I'm just going to go activate it. Now with that, I can go back to my report again. And if I click on the particular patient from there, you will see, and it takes sometimes a few seconds to refresh. Okay, there we go. So now what is happening in here is that I basically identified a set of patients which were based on a particular CDS hooks, but then based on that risk, I could have many other kind of algorithms configured that I can just kind of view from there. So in this case, it's a very simple kind of two different cards that we have configured, where it is showing me that, hey, this patient has a drug interaction alert, or this patient is actually eligible for a clinical trial. Now, I could have also gone and actually used this extension itself to run that algorithm on all the population health patients, on all the patients in the workspace, to kind of see like, okay, which patients are eligible for the clinical trial. So that was a very quick demo of you can use CDS hooks for population health analytics. I think they're just scratching the surface here. The possibilities are endless here, how you can actually implement this. CDS hooks always have had this limitation, or the implementations have had this limitation that you need to develop CDS hooks in a way that it is a sub-second response, because they're always used at point of care. But by using it in this approach, we don't have to have it fast, but we can really package a lot of AI algorithms, many of the other algorithms, in a way that can be reusable, that can be applied across many EHRs using the FHIR standard at the population health level. But once those cards are generated, then you have the options to really drill down and triage the patient in many different ways. We are still getting started on this and have been working with our customers to fine-tune this. So if you have any feedback, we would love to talk to you and see what we can do to make it better. Thanks again for watching. See you next time.